Okay, so we will start. We have now more than 40 attendance, which is a nice figure. It seems that the discussion today is interesting, will be interesting and attracting. So good evening, everyone in Europe, and good morning or good night to for the other continents. My name is Professor Shlomo Winker. I'm WONCA Europe Regional President until Lisbon. And I'm happy to host you all here in WONCA Europe webinar. We call it We Talk, WONCA Europe Talk. And in this series, we are inviting the candidates. Last week, we had a discussion with the candidates for the member at large position. And this week, it is the candidates for the position of President-Elect of WONCA World that will be elected very soon in Lisbon in WONCA World Council. Today we have two moderators from the executive board of WONCA Europe, Professor Eva Hummers, who is our honorary secretary, and Jose Miguel Bueno Ortiz, who is a member at large representing EQUIP. Okay, so we will start in a minute. At the beginning, we will have each one of the candidates will present himself and his vision and agenda for the next couple of years in the WONCA world. And then people will ask questions. They will ask questions in the Q&A, and the moderators will collect the most important and relevant questions and will ask the candidates. So I wish to all of us a very successful and fruitful evening, and we are now above 50, so it's a very nice figure. So Eva and Jose Miguel, the stage is yours.
Well, good evening, and thank you for being here, the candidates, and also everybody in the audience. And we will follow the order that was announced on the website. So I will ask Dr. Sri Ranjan to start presenting himself in 7 to 10 minutes, if possible. Please go ahead.
Okay, thank you very much, Eva, and thank you very much all of you all present today. My name is Dr. Sri Ranjan. I come from Sri Lanka. Thank you very much for inviting us and giving us an opportunity to share my views and ideas for WONCA. We are building for WONCA. I consider my role as carrying a baton in a relay as a member of the team for one term, recognizing that the president is a building block in the continuous effort to make WONCA stronger. My ambition is to make it even stronger. WONCA's daily business is run by Secretariat and led by CEO, who holds the continuity. To strengthen the Secretariat by supporting the CEO will be an explicit goal for me. The following three objectives from the WONCA strategic plan endorsed in 2023 is of particular importance to me. The most important one is to encourage ambitious professional development. High quality family medicine makes the difference for the world population. The most important out of three is to encourage ambitious professional development. High quality family medicine is important and it makes the world difference for the world population. WONCA working groups and special interest groups develop content and make sure those products are delivered to all the regions at grassroots level. One example is to secure development and use of ICPC, the most important intellectual property of WONCA. This is also a potential income for the WONCA. As I see, I come from a financial background, being a certified management accountant will be a valuable resource when we work improving WONCA finances. My second objective is to work for inclusive organizational culture. All voices shall be heard and all regions can be equally represented. Another one is to make sure that the global core values project will continue and thrive. I also want to tell you that there will be a book launch in Portugal, Lisbon. I'm sure all of you will be there because this has been a very good work by the core value projects. Thirdly, ensuring good governance. That means transparency, accountability, fairness is a challenge for all organizations, and its importance should not be underestimated. I'm committed to develop further the rural WONCA. It is deeply rooted in my heart. My origin is from a rural area in Sri Lanka. 50% of world population lives in rural area and 63% of people in South Asia are rural. If we can look after those entire rural population, we are covering almost 50% of the world population and we are achieving universal health coverage. I'm grateful to Bruce and Pretius for working very hard to bring this WONCA rural to an extent that is almost covering the universal health coverage. I also must tell you at this stage, when I was looking at the WONCA rural conferences in the past, from South Africa to Asia, now we are going to Wellington. So that means we are following the traditional migration of people in the past. So I hope all of you will be present in Wellington to know more about WONCA rural. I will see my role as president as a bridging force. I will work tirelessly to bridge primary care and public health, focusing on a very strong relationship with WHO. Not forgetting developing relationship with other stakeholders in primary care to ensure that the WONCA is relevant in policy dialogues. Bridging clinical practice and research is a requirement for our development. And I, as a president, would actively support special interest groups and working parties to share their knowledge and improve the profile of their excellent work done. Evidence-based medicine is important, but needs to be implemented at the life settings, real life settings. My own PhD addressed the relationship between the Western and the traditional medicine, which coexist side by side in a majority of countries and regions, mostly rural. So we must understand this and work accordingly for the betterment of the rural population. Bridging clinical practice and education means that the training must happen in primary care setting. We must empower our young doctors and nurture them to be the next generation of future doctors. Lastly, it is of fundamental importance to bridge the mindsets of high and low income settings. We need to reinforce equitable representation of countries and regions of different economic situation in WONCA. Friends, I'm committed to excellence in family medicine, compassion, and collaboration. With your support, my aim is to lead WONCA into a future where family medicine continues to thrive and evolve for everyone, everywhere, and for everyone. I come from a region mostly low and low middle income and rural, and countries with social disparity and unequal healthcare. Friends, basic healthcare is not luxury. It is fundamental right. Primary care with family doctors is a requirement. I would be deeply honored to be the first WONCA president from South Asia. Thank you very much. That's it.
Thank you very much, Sri Ranjan, for your presentation. The next candidate is Pilar Astier. So, Pilar, you've got the floor, please.
Are you able to watch my slides
Yes.
and hearing me properly?
Yes.
Yes.
Thank you. Thank you very much for the invitation to participate in this WONCA Europe Talk. An honor to be with other candidates, Dr. Ungan, Dr. Ranjan, to whom we share the commitment to strengthening family medicine and to WONCA World. Dear colleagues, dear friends, it's a pleasure to present my candidacy for WONCA World President-Elect in my home region, WONCA Europe. My experience in WONCA Europe brought me to WONCA World. Let me share my journey so far, although you all know me from here. I stand before you as a candidate, but also as a frontline family doctor with experience in rural and city practice for more than 20 years. Family medicine daily practice grounds me, and our work is about listening patients, working in teams, and supporting communities. But I am also associated professor of the University of Zaragoza, where I teach medical students to make family medicine attractive to them, to grow new vocational future family doctors. I also train and mentor family medicine residents to guarantee a turnover of those who are retiring. I firmly believe, united we are stronger, we can achieve much more. I choose to join the Spanish Society for Family and Community Medicine, and I've been the chair of the Patient Safety Working Party for 12 years. I have now a letter of support of the Spanish ministry to step up as president-elect of WONCA. I firmly believe that doing research to generate evidence could improve our daily practice as family doctors. So I joined EQUIP as a country representative, where I became actively involved in conferences, quality and safety research projects, international training course as the French Summer School of Quality Improvement. During the COVID-19 pandemic, we saw how absent primary healthcare data was from the news and from the policy discussions. In response, my dear friends, Dr. Sara Ares and Raquel Gomez and Marina Guisado and myself, we set up the Eurodata project within the EGPRN network to make primary care visible. We gather family doctor researcher of WONCA Europe from more than 35 European countries. We have produced evidence of the crucial role of family medicine in primary healthcare in Europe. We published research studies on clinical pathway, vaccination, pandemic indicators, among others. But this is only the beginning. We must continue campaigning for stronger primary healthcare infrastructure and for better primary healthcare data. However, we are convinced that to truly transform reality, scientific evidence must be translated into health policy so that research and policy are truly aligned with the needs of our communities. That is why in June 2023, the WONCA Europe Working Party on Policy Advocacy was approved by the WONCA Europe Executive Board to take on this mission. Since then, we have achieved several milestones: the 12 policy advocacy recommendations for family medicine, a published paper on the policy needs of European countries, and now, together with EURAC, we are leading the effort to secure recognition of family medicine as a specialty across the European Union with a common curriculum. I had the honor of chairing the WONCA World Working Party on Quality and Safety globally for 2 terms. Together with Dr. Jose Miguel Bueno and Dr. Valderas, worked to connect family doctors across the world who were engaged or interested in quality and patient safety in primary care. We organized webinars, activities to raise awareness of the importance of patient safety in primary health care. After these achievements, I stepped up to WONCA Executive Board when I was elected for 2 terms as member at large. This role gave me the opportunity to deepen my knowledge of WONCA history, its planning processes and regulation, and it also allowed me to ensure that the voices of member organizations and the academic community were all represented and valued. During my first term, I served as the chair of the membership committee and collaborate intensively with working parties and special interest groups, upholding their voice at global level through the participation in the WHO Stand Anniversary Platform. During my second term, I am serving as a WHO liaison officer with a crucial advocacy role on the World Health Assembly's executive board meetings and also networking with other non-state actors and making strong the relationship with WHO department to search synergies to work on primary healthcare and family medicine within the Universal Health Coverage Program along the globe. On this journey, my family and friends have always stood by my side. Together, we share the joy of living and loving because they are essential to me. Now, let me share with you my vision of how, as President-elect and future President, I will serve to strengthen family medicine and WONCA World. I will work together with you to advance in 5 key priorities. The first one, empowering primary care teams globally, supporting international family medicine leadership, promoting life learning, enhancing digital competencies in primary healthcare teams, and advocating for improving working conditions within primary care facilities. Integrating family medicine into medical education. Make family medicine a core subject. Medical students should experience the value of family medicine in early years. I will advocate for meaningful placements in rural and city health centers and strong departments of family medicine and primary care in universities across all regions. This will contribute to improving recruitment and training in family medicine for future generations. Raising global visibility of family medicine. I will work to promote family medicine as a cornerstone of universal health coverage, with one unified voice, promoting and enhancing strong partnership with WHO, United Nations, and other crucial global health actors. The recognition of the role of family medicine in universal health coverage, improving research and evidence to get innovation in family medicine globally, and promoting global health and planetary health responsibility. Promoting quality and patient safety in primary health care settings. Quality and safety are the heart of family medicine performance. It offers useful tools to manage healthcare risks and reduce incidents that harm patients in our daily busy practice. Therefore, some tools are strengthen WONCA accreditation programs, expand training in patient safety and quality in primary healthcare teams, and boost safety culture in primary healthcare professionals. And of course, support the aftermath of adverse events when things happen that we are not planned that way and harm patients. We need to support patients and families and professionals. Share best practices to learn from each other, and a global core curriculum on patient safety within countries, regions of WONCA World. Finally, collaborating with public health and community care, foster holistic models, advance in community-oriented, multi-professional primary care models that brings together health, social support, well-being, prevention, and planetary health through initiatives such as social prescribing or sustainable strategies for delivering healthcare. And then intersectional collaboration to lead to address health crises together, promoting evidence-based decisions to make healthy communities and empower communities as partners in our journey for a healthy world. I am the strongest option for your vote. Proven leadership.
Come to your close, Pilar, because it's over.
I'm finishing.
Okay.
Thank you. Proven leadership and achievements in WONCA. Hardworking and proactive and collaborative person to address collective projects. Transformative female leader, rooted in South Europe, but open to the world. Together, we can build stronger, safer, and more equitable health system, a global commitment rooted in community, un compromiso global arraigado en la comunidad. Juntas y juntos podemos construir sistemas de salud más fuertes, más seguros y equitativos. Un engagement mondial ancré dans la communauté. Ensemble, nous pouvons construire des systèmes de santé plus solides, équitables et sûrs. I'm happy to keep this conversation going on social media. Thank you very much.
Thank you very much, Maria Pilar. We will now go over to the last candidate, which is Professor Mehmet Ungan. Your floor, Mehmet.
Can you hear me and see the slides?
Yes.
Okay. As a colleague and a fellow family doctor, and now as a candidate for WONCA World President-Elect, it is a true honor to address you today. And in this WeTalk, which we have already created all together with my colleagues in my term. WONCA member organizations have always been the engine and the pioneer of the innovation in family medicine, and Europe stands proudly among them. And my own journey is deeply rooted here. I will tell about myself a little bit because in Europe, many colleagues know me here, but I see that from other continents, some other colleagues are also participating in. I am Mehmet Ungan, a family physician and a professor of family medicine at Ankara University.
Mehmet, we are still in the first slide. If you want slides
Yeah,
to go, just
come on. Yes, please.
Yeah. Okay. And I began as a young doctor in Istanbul, built my academic career at Ankara University. My journey has combined patient care, teaching, and leadership as president of WONCA Europe, president of EGPRN, and now as co-chair of the Scientific Committee for the Lisbon 2025 WONCA World Conference. During the pandemic, WONCA Europe executive together turned crisis into opportunity, securing financial stability, policy influence, stronger scientific visibility for family medicine, and a stronger WHO collaboration. I want to bring that some resilience to WONCA globally, supporting all family doctors in turning challenges into long-term gains. Achievements and priorities in Europe is another issue. Family practice sometimes can be professionally isolating. Education and mentorship must close that gap. We made research a cornerstone as EGPRN president. We have launched the EGPRN research course, now has more than 800 participants worldwide, free, open, and permanently accessible. Imagine adapting this for all family doctors in every region so that local practice informs global evidence. WONCA should build inter-regional mentorship networks connecting young doctors with peers and senior mentors across continents. Every person, whether in capital city or remote village, deserves quality primary care. We built strong bridges with WHO Europe, producing practical guidelines on NCDs, vaccination, therapeutic patient education, and digital health. We created sustainable platforms for collaboration, including the World Book of Family Medicine, European edition, bringing together voices from across the continent. Globally, WONCA can champion friendly policies. We promoted advocacy and solidarity during the pandemic, working closely with Dr. Hans Kluge and WHO Europe to support family doctors under pressure. Shared challenges for Europe and world is apparent. Our strength is our diversity, from Nordic countries to Balkans, from Eastern to Southern Europe, but our challenges are almost shared. Workforce shortages and migration imbalances, digital transformation and the need for governance of AI and telemedicine, equity in access to care, especially for migrants, refugees, and marginalized groups, burnout and mental health of family doctors, climate change. My vision for WONCA is simple, my friends. If elected world president-elect, my vision builds on this European experience for the whole WONCA family. Practical solutions for the frontline, from NCD guidelines to digital tools, turning research and knowledge into daily tools for practice. Every region, every voice moving forward together, ensuring family medicine serves not only clinical excellence, but also equity, sustainability, and compassion, keeping the human touch at the center of care while embracing innovation. This is not only what I believe, but what I have practiced. This is not theory for me, I have practiced it. From refugee health in rural Turkey to mentoring young colleagues worldwide to shaping global vaccination projects, I have always sought action rooted in unity and guided by purpose. This is an invitation. In just a few days, we will gather in Lisbon for the WONCA World Conference 2025. As co-chair of Scientific Committee, I warmly invite you to join us. The program reflects our shared priorities: sustainability, digital health, planetary health, and irreplaceable human touch in family medicine. It will be one of the largest global family medicine gatherings in history, and Europe will be at its heart. Dear colleagues, WONCA is more than a network, it is a family. Together, through action, unity, and purpose, we can strengthen family practice, and with it, global primary care. We can ensure that our discipline remains clinically excellent, socially responsible, and globally influential. Thank you for your trust and for walking this path with me.
Thank you, everyone. Now it's time for questions. And we are quite a lot of the questions actually do address the issue of Gaza. Now, this should not become a political statement forum. On the other hand, I cannot see how this question could be ignored right now. So I would ask each of you to give a brief answer and to tell us a bit about your ideas and your plans on how you would address this issue during the presidency or a time as a president-elect. Please do not go into long political statements, though. Dr. Sri Ranjan, please.
Yes, thank you, Eva. I think we should look at this Gaza as a humanitarian aspect, not as a political ground, because we must ensure that the safety of all healthcare workers, children and ladies, and those who need medical attention, they should be given priority. So, and also we must work very closely with, and also the statements issued by those people like Red Crescent, Red Cross, WHO, United Nations, whatever the statement they make, we also must make it very consistent with them. And thirdly, we must always make sure that everyone gets the food, water, and healthcare access, medicine, so that we should need to address that. I think basically we need to address that there's a problem, that we have a mandate to solve it by addressing on a humanitarian grounds. And then we need to address this because this is a issue. So I will take it as not a political issue, but it as a humanitarian issue, making sure that, you know, everyone gets access to healthcare. That's a statement that I will be making. Thank you, Eva.
Well, my position is aligned with the WONCA recently statement on conflict areas and the WHO position as well. In any conflict, humanity and health must come first. Attacks on health workers and facilities are unacceptable, and humanitarian access to food, water, medicine must be guaranteed. As family doctor, we stand medical neutrality, dignity, and peace as foundation of health. WONCA must remain a bridge, never a barrier, between doctors, between patients, and communities, whatever the conflict. Our voice is strongest when it's united, ethical, and focused on protecting health and dignity above all. So we stand on our family medicine values.
Yeah, I fully agree with my two colleagues. I think nothing more to say after Maria mentioned, especially the statement. To my opinion, WONCA is a family, as I told you. this is important in the family. If you have some disagreements or if you have some humanitarian even problems, then it would be very nice to talk, to sit down and to talk and to take care of the health of the people, especially, which is our global aim, you know, just collaborating and supporting each other for the best health conditions for anywhere in the world, any region, any condition. So this is what I can tell you right now. And of course, if there is something to be needed to be done, it will be done all together, deciding together.
Eva, can you hear me? There is another question about what could be to be answered by you three. What is your policy to achieve the recognition of the specialty of general practice family medicine?
Okay, thank you very much, Miguel. I think we need to talk to governments, universities, and to make sure that the proper training program at the undergraduate level takes place. And then when they come to postgraduate level, a good program acceptable by the medical council and the country, so that they can approve it as a specialty in family medicine. Because the problem that we have at the moment is everyone is looking down family medicine as not a specialty. Those doctors are a bit on the low side. We need to change this mentality by focusing ourselves. And also the WONCA can make, we will make an effort through WONCA. So such family medicine specialty is a specialized field which delivers primary care. Thank you.
Thank you for the question. I think it's a really important question. We have started in the WONCA Europe Policy Advocacy, a new project on the recognition of family medicine specialty within all the countries in Europe, and we are committed through the countries to highlight the member organization role on asking to the governments to ask for the recognition of the specialty, and then build a sound and common curriculum on family medicine, and then finally being recognized in all WONCA Europe. This is a pilot experience, but we want to extend it to the rest of the regions. And I think WONCA World can be a very supportive role on this issue. We have a family medicine working party on education that have highlighted a very complete curriculum, and then we can develop it in the WONCA regions. We have another experience of recognition of a specialty in the East Mediterranean region, where in collaboration with WHO, EMRO, they develop a diploma on family medicine that is being quite successful in guaranteeing a common co-curriculum to have the recognition of the specialty in the different countries of the region. So I think that WONCA World will support the different regions on the challenge to get the family medicine specialty recognized, and then increase the quality and safety of primary health teams with a strong leadership of family medicine, no matter the practice where you are in the world. Thank you.
Yeah, again, I fully agree what you are saying, Maria and Ranjan. To my opinion, for being a very strong discipline, every discipline needs three aspects. One of them is, for sure, it's an academic being. The second one is a political decision. And the third one is a strong organization. So I think we have enough for them. and it's not at the beginning stage. We are already running, what we have done until now is also, I think, what we should continue. During the WONCA Europe period and during Shlomo's period also, it continues, that we have been trying to participate into research with other disciplines. That makes the recognition of the family medicine and general practice more and more every day. If we can make research available in our discipline, reliable and strong research, which is evidence of a discipline, it will be much better than any other effect, according to my view. So I think participating into European projects or worldwide projects with other disciplines, like the projects which we have done with even with the periodontologists or cardiologists or with the urologists, other disciplines has seen that general practice is really producing the knowledge and a good quality of knowledge, which is at the end of the day useful for the health of all populations and all regions. Thank you.
Thank you. There was another question to all candidates, which I would like to pick up. And that was, there is increasing global interest, actually, or interest all over the world in a multidisciplinary team approach to delivering primary care. And how do each of you see the role of the family doctor in such a team? Dr. Sri Ranjan.
Can you repeat it, please?
It says that everywhere in the world, primary care is increasingly seen as teamwork of a team with people from multiple professional backgrounds. And how do you see the role of the family doctor in such a team?
I think the family doctor is the key person there who should coordinate with every person in delivering healthcare to rest of the people. He should take a lead in promoting shared care and delivering the comprehensive care and all the important matters in the family medicine. I think he should take in charge, and then he should coordinate with the rest of the people in delivering primary care.
Thank you. Pilar.
Okay, and my first key priority is to enhance and empower multidisciplinary teams where family doctors are the clinical anchor, the clinical leader that integrate inputs from nurses, pharmacists, social workers, mental health professionals, and community agents. WONCA aligns with WHO vision on primary healthcare as team-based, because family doctors will work side by side with nurses, midwives, and physiotherapists, psychologists, and other professionals, promoting training together to strengthen the care for chronic conditions, multimorbidity, mental health, palliative care, and preventive interventions. As well, we leverage community health workers and social prescribing approaches to connect patients with local assets. So our role will be as leaders and coordinators, and we will promote from WONCA interprofessional education, where medical students and family residents learn with and from other health professionals to foster mutual respect and share responsibilities in real workplace, defining quite clearly the different tasks that contribute to improving person-centered care in primary healthcare.
Thank you. Mehmet Ungan?
Yes, the multidisciplinary teamwork is the core of the primary care. So at the end of the day, although it depends on region to region, there is the needs changing. Sometimes the family doctors or general practitioner is too busy with other tasks which should be coordinated, and also missing some coordination. And that's the reason the role of the head is changing from one professional to other professional in the team. But it is depending on the region, as I say. So that is the reason I think we can accept the core of the team is the family doctor and general practitioner, of course. But on the other hand, if the need changes and there may be shift of the rules for some regions, especially in rural areas or some other parts of the world, which the primary care should be provided urgently, especially. So multi-professional teams are really necessary for those regions, especially.
Thank you. There's another question for all three. Says that what innovative and sustainable strategies can be implemented to address the shortage of family physicians in rural areas, considering workforce distribution, financial incentives, training models, and digital health solutions?
So this is a very important question to answer, because in rural WONCA, one of the biggest problems that the WONCA is facing is a shortage of doctors in rural area. As you said, if you give enough incentive and the education, CPD program, and then connectivity for them to use digital things and telemedicine, they are of lot of values because they feel isolated in a rural area. So they need to connect with technology for learning, to get an opinion from a specialist. People from the rural area have to travel far and they may not find a specialist. So technological innovation might be useful to contact a specialist over the and then give some solution to those people. I think the tech, and then also for rural doctors to give a lot of incentives. So developing the infrastructure to have delegate the job to paramedical staff like the nursing and things, so they might be able to really reduce the workload so that the burnout feeling of rural doctors can be sorted out. Thank you.
Thank you. So addressing the shortage of family doctors, particularly in rural areas, require a comprehensive multi-level strategy. However, first, we must strengthen multidisciplinary primary care teams, as Ranjan has said previously, but we have to start from the beginning. We have to connect medical students for the rural practice, facilitating rural placements to improve the connection and knowledge about the way we work in rural areas. So that will be interesting for them to work in as vocational family doctors in rural areas. Second, we need incentive really to attract and retain doctors in rural practice for contracts, professional development opportunities, housing and family support, and career recognition equal to human colleagues. Then training must be rooted in the community, and rural doctors are really connected with the community, and especially because they live in all their life within the community itself. So they are really connected and have the trust of the community too. So reinforce the role in the community, is the leadership in the community is really important. And finally, investment in digital health, telemedicine, and infrastructure that ensures equity of access, but as well support professionals in their working in isolated settings. WONCA advocates for these measures globally, recognizing the strong role of rural family medicine and our rural family working party is essential to maintain the training, providing webinars, and make like a network of family rural doctors to maintain their competencies, and as well to guarantee the universal health coverage, reducing health inequities around the world.
Yeah, such kind of questions were discussed in one of the rural health meeting, if you remember, Maria. I think the same answers I would give actually. Digital solutions are really very important for training and also for the daily practice for the rural doctors. And I think we have to be simple and try to maintain and also support in that direction our member organizations about the digital infrastructure in training and daily practice. And of course, in medical education, if we can just integrate the rural medicine inside of the training or in some parts of the training, then it will be also very good. But the political decisions of those regions and also the countries are very important for the incentives and positive incentives, especially for making it a little bit more charming to go those areas and to work in those areas. And rural is everywhere in the Europe also, you don't need to be in poor areas only, but also islands and such kind of isolated places. Many colleagues are needing really, even the research course participants, most of them are from rural areas. That shows us that the training need is really expressed by them, and we are trying to meet their needs, and it will be like this.
Okay, there is several questions that are somehow related to the issue which you just answered on shortage, but they ask specifically about low-income countries, about Africa, about low-income countries in general, and they said, yes, it's often resource limited, it's often everything. It's limited investment, limited workforce shortage, lack of recognition, and sometimes systems where it's difficult to move things. So they're asking about your ideas on what to do about family medicine in these contexts specifically, if you have any idea on how to improve it.
I think the number one, we need to give them a lot of incentives. And also, sometimes, although you don't get so much of incentive, you need to have some dedication to serve your underprivileged people. And then they seem to be isolated most of the time because there's no help from any person, not even from the peers. So, and then the family has to be looked after, and the schooling and infrastructure has to be developed in a rural setting. So unless we do that, it may be, and also it's politically, and then the political leaders, WONCA, WHO, and all the other agencies should look into this and how best we can deliver a universal health care to people who deserve it. As I said earlier, 50% of the world population is rural and underprivileged. So I think we need to lobby with the government, providing more infrastructure to the rural areas and give more incentive, and then schooling for children, housing, all those things need to be looked into. It's a complex issue. We can't sort it out overnight, but it takes a long time, but it can be done. I think we need to speak to people, lobbying stakeholders in order to achieve that. Thank you.
Thank you.
Thank you. Can you hear me?
Yes.
Yes, sir.
All right. Well, most WONCA must stand firmly with low-income countries to directly expand the universal health coverage program through primary care over the world. So we will support regional, we will support low-income countries in the advocacy with WHO for investment, for government investment in primary care, strengthening family medicine everywhere. That is crucial in our policy advocacy role. Then from within WONCA organization, sharing training resources openly, training programs between high and low income settings that support family doctors in low income countries, and as well supporting regional conference there to improve and enhance those regional conference and the opportunity to meet and identify the needs of those low-income countries. So I will say to highlight the advocacy role on WHO, United Nations, then to harnessing WONCA working parties and special interest group, particularly rural working party on providing sharing training resources openly and trying to build up training programs and facilitating scholarship for young doctors and rural colleagues from low-income countries to participate actively in our WONCA conference, regional and globally.
Yeah, that is a really important and actually very urgent question. And low-income countries face some of the toughest challenges in the building and retaining the health workforce. And WONCA, as the global voice of family doctors, often frames its role around advocacy and, as Maria said, training and system support. I think strengthening family medicine training, retention and incentives, and digital and innovative approach, policy and advocacy, community and sustainability are the things which we should focus on for increasing the workforce, actually. Also, it is not only in training the WONCA role and capacity building, also it's not only this one, but advocacy, making sure the voices of low-income countries are heard at WHO. It is an important work, and in World Bank especially, and those donor levels, so financing and recognition flow to family medicine, those are important issues. What we can do is, I think we cannot directly tell you that this is the magic solution, but what we can do is, as WONCA, I think we can increase our efforts to support the local and regional places for especially urgent health workforce. You know, we can just visit there, we can talk with the politicians, and we can do our best to advocate.
Okay, thank you. So now our time is really over. I would give you the, well, if there is, but make it short, a last short statement that each of you would like to give. Not necessarily, but if there's something you would like to add, you get another minute or so.
I think we should make WONCA relevant in dialogues with all the other stakeholders, WHO, United Nations, and secondly, to coordinate with public health research and improve the rural health. And we must go green and paperless conferences and support the carbon footprint. And those are the few things that I want to add apart from that what we have discussed. Thank you, Eva.
You're welcome. Pilar.
Thank you, Eva. Well, my campaign is guided by strong family medicine is the foundation of strong health systems. And as president-elect, I will bring the daily experience of family doctor, the research into policy advocacy, and the vision of international collaboration, and then deep commitment to equity and community. I believe together we can make family medicine more visible, more influential, and better supported worldwide. Our patients and communities deserve nothing less. So a global commitment rooted in the community. Thank you.
Thank you.
Yeah,
Mehmet.
I would like to thank to all of you, and I think the importance of fostering intergenerational leadership and mentoring young doctors while honoring the legacy of those before us is important to mark here. And I think I have seen there is a huge digital transformation of the WONCA infrastructure. But I think one of those things which I would really like to discuss with all of you later on, just to make this transformation, how to make it, how to improve it for just touching the base for all the regions. This is an important issue also for the future, for training and for research purposes. Thank you.
Well, thank you, Ranjan, Astier, and Ungan for your participation in this special WONCA Europe talk. And now, closing, the floor is for Dr. Shlomo Winke, WONCA Europe President, to do the closing.
Okay, I will be short because we are running out of time. First of all, I want to thank to all the participants that join us, more than 60 participants. Several of the names I recognize and others I didn't recognize, so it means that we catch a global interest in this We Talk webinar, which is nice and a good achievement for us as WONCA Europe. Second, I want to thank the two moderators, Eva and Jose Miguel, for moderating. And last but not least, to all the three candidates, I think that this hour gave us more insight about your vision, about your plans, and whoever that will win, I hope that we will see all the three of you continue to lead family medicine globally. So thank you and good night for the Europeans, good night for those that are in the East, and
In the
good
middle of
morning
the night
for,
already.
yeah, or middle of the night already, and good morning to our participants from North and South America. So good night and thank you, everybody.
Thank you very much.
Thank you.
Thank you,
Thank you very much to
Michael.
all.
Thank
Thank
you.
you.
Thank you, Dr.
Thank you.
Ranjan. Thank you,
Thank you. Thank you, Maria.
Thank you very much.
Ungan.
Thank you.
Thank you to the
Bye.
audience.
Bye.
Bye.
Bye.